All right, welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health. Dr. Vinita Dubey joins me again this week. Thank you so much, Doctor, for being here.
Yeah, my pleasure. Absolutely.
Thank you. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. The way it works is we have been collecting your questions from social media all this week, and we will present them to the doctor. She's never seen them. This is all off the cuff. If you haven't had a chance to submit your questions, you can still do so under this live broadcast, and we're going to try to get to as many questions as we can. We only have 30 minutes with the doctor, so if we do not get to your questions, I will save them for next week. That's what we've been doing so far as well. The cache of questions I have are some from next week, some from last week, some from this week, and so it goes. So we'll get started right now. Please start submitting your questions, and we'll get to them as we go. Doctor, are you ready?
Yeah, let's go.
All right, wonderful. Let's start. Once again, this week, we are starting with vaccine questions because those seem to be urgent and top of mind for most people. So we'll start with Cindy and D. Best. They both have the similar question. They ask, if someone is fully vaccinated and they get the COVID virus, but do not show any symptoms, are they still infectious?
Okay, so I guess the answer to this is difficult to say because are you likely to get an asymptomatic infection if you're vaccinated? And the answer to that is usually no. We know that you're less likely to spread the virus if you're vaccinated, and so that usually means then you're less likely to get an asymptomatic infection and to spread it. And even those who get symptoms, get COVID with the vaccine, again, the number is very, very low. Early data in Ontario showed 0.06% of people who got any dose of vaccine actually got COVID.
Right, okay. And then Belly asks, they are concerned about mixing and matching the vaccines. Is it safe?
Yes, the one thing we know is that it is safe. Yes, so we know that one AstraZeneca, one Pfizer, or Pfizer and then AstraZeneca or Moderna, whatever it is safe. Then the other question becomes, what about Pfizer and Moderna? Is that safe? And those two vaccines, again, are very identical. And if we don't have enough Moderna, we have a lot of Pfizer, well, then we'll need to complete the series with Pfizer, and that is safe. So if you have a mixed schedule, you may get a bit more of a sore arm or a fever, not feeling well. But beyond that, there are no other concerns with safety. One of the reasons for doing it is because with AstraZeneca, there is that rare but serious side effect that can cause those blood clots. And so we're trying to avoid that. And that's why we're looking to other vaccines.
Right. And let's move on here. Rich asks, I have the first dose of the AstraZeneca vaccine. Which vaccine should I take next?
So you actually have a choice. You can either get AstraZeneca for your second dose, or you can get a messenger RNA vaccine, which would be Pfizer or Moderna for that second dose. And definitely would leave it to you, but know that with that second dose, the messenger RNA vaccine, that rare side effect for that blood clot is not present, and the vaccine will work better for you. Also, that vaccine may be more accessible for you. A Pfizer vaccine dose is actually more easily accessible as well.
Right, absolutely. And actually, we have a live question coming in here now from Nancy Miller. She asks, how long does the vaccine last after the second shot? Will there be a third shot, as is being mentioned in many countries?
Right now, there's no plans for a third dose. The second dose is providing good protection, like in those countries like Israel that have had 2 doses, the US as well. It is continuing to provide good protection. Where a third dose may come in is if we have a new variant where our vaccines are not providing the best protection, or if in time the vaccine immunity wanes. And we're not just sure. Right now, there's no evidence that there's waning immunity and that a third dose is required at the moment.
Right. Okay. And then actually another live question coming in here from Gary Short. They ask, I got the AstraZeneca vaccine, first shot. Why do I have to wait 12 weeks for my next shot when the other vaccines require just a 28-day wait?
Okay, well, actually, there's a very few number of people who are getting that second dose in that 28-day range. And so, you know, it's if you've had a transplant, if you are very immune compromised, getting chemotherapy, for example, if you're a healthcare worker working with COVID patients, I mean, there's very few groups that are getting that shortened second dose. So even if you got a messenger RNA for your first dose, you are getting a bit of an extended interval for that second dose. Right now, the 12-week interval for those who have got AstraZeneca is based on vaccine supply. In the provincial documents, it talks about 12 weeks, and that could change if there is more supply available.
Right, right. But doctor, you've also mentioned before, when it comes to AstraZeneca, the longer gap is actually better. It makes it more effective, right?
Yeah, so good point. So we know when you get AstraZeneca and then AstraZeneca for your second dose, getting that second dose at 12 weeks gives you better protection than getting it at 1 month. Right. Now, it's not clear if you get AstraZeneca and then Pfizer or Moderna, is it, 1 month versus 12 weeks? Does that still hold? But it probably does. I mean, we do know, we've talked about this, that for that second dose, having some interval, like 8 weeks, 10 weeks, 12 weeks, is actually probably beneficial for most people to get that boost in immune response. It's just those people who have a very weak immune system, that first dose is not providing them with very much protection. Getting that second dose sooner is actually more recommended in those situations.
Okay, let's do this one more live question and we'll go back to our submitted ones. Susan asks, what happens if I have a serious side effect from the vaccine and get permanently injured and can no longer go to work?
Okay, so the serious side effects from the vaccine causing permanent injury with the Pfizer and Moderna have not been noted. There have been no serious side effects that have been directly linked to the vaccines. Some people, 1 in 200,000, can get a severe allergic reaction, but that's treated right away. There is this safety signal that has been identified with myocarditis or pericarditis, mostly occurring after the second dose, mostly in teenagers or young males. And a lot of them, in fact, in pediatrics, there's an article that was just published that looked at 7 people who got this, and it was treated actually just with treatments and resolved. So again, that permanent serious outcome following, especially the messenger RNA vaccines, have not necessarily been identified. But if there is something that's rare, we do now in Canada have this vaccine injury compensation program as well.
Yes, absolutely. I think that was recent. You've been mentioning it a little for a while, and it's been recently announced as well that there definitely will be that compensation available. So, okay, let's move on. Okay, Deb asks, can you tell me what the long-term effects of any of these vaccines are?
Well, I can only tell you out to 6 months to a year, because that's really the interval that we've had the vaccines, and no long-term effects have been identified in that range. I can, though, say when we talk about potential long-term effects from the vaccine that are theoretical right now, we also have to talk about the long-term effects from COVID, and those are very real. We know that maybe 20% of people who get COVID can be long haulers, and their symptoms have gone, they're not contagious anymore, and still they have these very stubborn symptoms. People who have COVID long really talk about it as being very difficult, fatigue, difficulty with exercising, trouble breathing, that brain fog, trouble concentrating, and it's not known how to treat that properly either. So I think that is a known long-term effect from COVID that we have to balance with a theoretical long-term effect from the vaccines, for which there is no evidence right now.
Right, right. Okay, we'll go back to our submitted questions for now, but you can keep submitting your questions live as well. Diana asks, is there any advice for people who are over 70 and whether it may be better to take a second dose of AstraZeneca if you've got the first dose of AstraZeneca, or switch to mRNA vaccines? If I proceed with the second shot of AstraZeneca, and if a booster is required in the fall, would I then have to switch to an mRNA vaccine at that point?
Okay, so getting that second dose of AstraZeneca when you got the first dose, the most important thing that you have to recognize is there is a small but present risk, 1 in 600,000, of getting that rare clotting disorder, 1 in 600,000. And so that's really the biggest thing that you have to consider in terms of risks of getting the AstraZeneca for the second dose. We know with getting AstraZeneca and then getting a messenger RNA vaccine, like Pfizer or Moderna, the antibody responses are actually strong. In some studies, maybe even stronger. And so that is maybe a safer, the risks are low with AstraZeneca, but even still, it's even still safer with the messenger RNA and likely still to get you a very good boost response. So that's for dose 3. Now, for dose 2. Now, if for dose 2 you decide to get AstraZeneca, that's fine. For your third dose, again, these vaccines work in about the same way. And so getting a third dose, you wouldn't restart the series. If a third dose is recommended, it would be a third dose of probably whatever is available.
Right. And currently there is no third dose recommendation.
No,
right?
yes,
Right.
yes. Thanks for clarifying that. It's just if it became recommended sometime down the line, yes, it wouldn't necessarily have to be the same vaccine.
Right. Okay. And actually, that sort of you kind of answered this, but let's put this in a proper question. Wings has a related question. How long does the protection last after you get that second dose? And then if the protection does end and you need to get that revaccination, would that be a 2-series vaccination, or would you just get the 1 shot for a booster?
Okay, yeah, so good question. So really after that second dose, we know the second dose works very well to boost your immune system, which means that your immunity gets up and it's staying up right now. Right now, there's no sign of it really falling off after that second dose, which is good news. Definitely lasts for 6 months, probably lasts for much longer than that. We haven't had it really for that long. If, again, a third dose is required, it would be a boost. And so it wouldn't be now restart the series. That's not what's anticipated right now. And it might be more akin to like the flu vaccine. Actually, if you're less than 9 years of age, the first year you get your flu vaccines, you get 2 doses that year, and every year after you get 1 dose. And so that's an analogy for, where 2 doses might be required up front and then 1 dose thereafter.
Okay, that sounds good. And then, okay, lots of live questions coming in here. Let's go with Linda. Linda asks, are the mRNA vaccines a chemically made COVID? Why did I have a lot of these COVID symptoms? I'm assuming after getting the vaccine.
Okay, so the way the messenger RNA vaccines work is that messenger RNA is an instruction manual. It's an instruction manual for your body to make a spike protein. Now, the spike protein is just a single protein that you make. It's similar to the protein that's on the outside of COVID, but it's just one single protein. By making that protein, your body then produces antibodies against the protein. The messenger RNA is gone and the spike protein is also gone, and you're left with the antibody. So that's how it works. Now, in that immune response, making the antibodies to attack the spike.
Sorry, we're just having some technical difficulties. Sorry, doctor, we seem to have lost your audio soon after you were talking about making the spike protein.
Hi, it looks like my call dropped. Sorry.
No worries, no worries. So sorry, we were talking about how the vaccine works, and basically you're left with the antibodies that attack the spike protein.
Right. And so by producing those antibodies, going through that process after vaccination, some people can get symptoms. That's their body developing that immune response, which can feel a little bit like COVID, a mild case. Fever, headache, not feeling well, body aches. That's not because you got COVID. There's no COVID in the vaccine, but it's because your body's producing that immune response.
Right, absolutely. Okay, and then Aslam asks, and I'm not sure we have both these vaccines here. I know they're versions of AstraZeneca, but Aslam asks, which vaccine is better, Covaxin or Covishield for citizens who are 60 plus?
Yeah, so we don't have those vaccines available here. In terms of which vaccine is better, wherever you are in the world, if that's the vaccine that's available to you, that's probably the best vaccine because COVID is probably circulating in that place. Now, the World Health Organization does have a list of WHO approved vaccines that you could also consult as well.
Okay. And then I'm just going to go through this as they come in. Priya asks, Dr. Dubey, what are your thoughts on digital contact tracing? And do you feel this would play a role in identifying the spread and play a role with vaccine distribution, like how we actually give out vaccines?
So it's hard to understand what digital contact tracing means. Like, I think in some countries, when you go, you get a wristband when you come off the airport, out of the airport, and they monitor you to make sure that you're quarantining. We certainly haven't done anything like that. We do have something like apps. The federal government has the COVID-19 app, which is kind of like digital contact tracing. So if the more people that have it and that use it, you know, if are positive, that can give you, let you know, well, you were in close contact. It won't say who you were with someone who got COVID. I think the point about contact tracing is that you want to be able to identify who you may have had close contact with to notify them so they can isolate. Now, there's a couple of things that I could say. One is, well, if you're vaccinated with 2 doses and you have a strong immune system, you might not actually have to isolate if you've had close contact with someone. You just have to watch for symptoms. So that's certainly one place where vaccinations are going to play a role in the future for getting COVID and even for contact tracing as well. Right. The other thing to say is, as long as we keep our distance from other people, well, then, you know, you won't have close contact with anyone. And it's really that close contact, especially in indoor environments, where COVID is more likely to spread.
Right. And then just that second part of the question, when it comes to contact tracing, do you think sort of keeping track of those contacts will play a role then in how in vaccine distribution, in how we distribute our vaccines and where?
Well, I think right now the goal is to give vaccines to anyone who wants it. Really, anyone who's 12 years and older is eligible for vaccination. And I think really there's no role that once you've been exposed to someone, if you get vaccinated at that point, there's no evidence that the vaccine will help you prevent getting COVID. If you've already been exposed, we've seen this in the first 14 days of vaccination. That's when most people who get COVID because they're not protected by the vaccine. So really, we want to be vaccinated before we have that exposure.
Right, right. And then Johnny asks, do the vaccine manufacturers recommend mixing doses?
So the vaccine manufacturers, they have their vaccines licensed as per their schedule. So some can choose to do mixed vaccine schedules and get them approved that way. It is very common in vaccine research, in vaccine implementation, where those mixed schedules are studied after vaccines have been manufactured. And some of the decisions about mixed schedules is based on actually real-time data. Mm-hmm. You know, and so the data on the mixed schedule on AstraZeneca and then a messenger RNA, the big reason for that recommendation is because of that rare side effect following AstraZeneca. And if we can avoid that, well, let's avoid that, for example. So I think some of the recommendations that come out from advisory committees on immunization based on more real-time data are to reflect what's actually going on currently during the pandemic.
Right. And okay, more live questions here. Let's go to Jennifer. Jennifer says, I got the Pfizer vaccine on April 20th and I contracted COVID-19 on April 29th. When can I get the second dose of Pfizer?
So actually, once you're eligible for your second dose, you can get your second dose. So you don't need to wait for a longer interval by any means. I'm sorry that, you know, you were in that first 14 days, you got it on the 20th and then you got COVID on the 29th. And again, that first 14 days seems to be the time when people are not protected and get COVID. But now that you've gotten COVID, you've gotten one dose, you can complete your series when you're recommended for your second dose.
Right. As long as you don't have symptoms and you're not contagious.
That's right. And I imagine now in June, that's the case. So yes, but that is absolutely right.
Right. And then, right, actually, you just answered this question, but Helen says, if you had COVID, how long after can you get the vaccine?
Yeah, and so again, as long as you're not contagious and you can safely come to a clinic, you're eligible to get the vaccine.
Right. Okay. So I'm going to go back to our submitted questions here because people have been submitting all week. Let's go to Charlotte. When is Ontario going to shorten the waiting period for the second shot of those who got AstraZeneca? We dutifully got this vaccine for the greater good, and I feel like we're being ignored and put at risk. The UK has moved it to a 2-week interval.
I don't think anyone is providing a 2-week interval. I don't think anyone is giving one vaccine and then the second vaccine 2 weeks later. Yeah. The earliest interval is 21 days, and that's for the Pfizer vaccine, 28 days for Moderna, and 28 days for AstraZeneca. That is the shortest interval you can get. Right. Maybe what you mean is they're making the interval, you can get it 2 weeks earlier. Mm-hmm. And I think that even getting it at 12 weeks is a shortened interval because most people have been scheduled out to 16 weeks. Right. And the province says in their documents that if we have enough supply, then everyone's intervals can be shortened, including those who have had AstraZeneca. So I would just say, wait and see. We're kind of in this place right now where we're moving to second doses earlier, which is really fantastic. Mm-hmm. But our rates are still, 25, 30% of people haven't been vaccinated. And so we also still have to make sure that we have enough vaccine and that they come out and that we get them all vaccinated as well.
Right, absolutely. And then let's go to Nancy. Nancy says, I heard that AstraZeneca will work better than the other vaccines against the variants. I had Pfizer on April 8th. Would it be better for me to get the AstraZeneca vaccine for my second dose now because it gives you extra protection against the variants?
So that's not an option right now. And there's no evidence that AstraZeneca is better against the variants, actually. So, when it comes to the Delta variant, the Indian variant, the AstraZeneca and the Pfizer, the second dose of that both give very good protection. We actually know for AstraZeneca that it actually doesn't have the best protection against the South African variant. Mm-hmm. And the messenger RNA vaccine does. So just want to clear that up.
Yeah, absolutely. And then, okay, let's go to Dina's question. Dina asks, if we had a first dose of AstraZeneca at the beginning of March, when will I be able to get a second dose of Pfizer in Ontario?
So you should be eligible now, actually. If you got, it's based on the dates. And so I don't want to misquote the dates, but if you got a vaccine in March, you're eligible for your second dose now.
Yes. Okay, wonderful. And then Patrick asks, so he got his first dose and was given an appointment for his second dose, but because the intervals have been shortened now, do we need to rebook online following those new guidelines?
Yes. So if you're eligible for an earlier second dose, so depending upon the date when you were vaccinated into April, or depending upon your age, you can get an earlier second dose. And so then should you book it? Well, it depends on where you got your first dose. It doesn't. So if you booked it through the provincial booking system, like I can say Toronto Public Health or City of Toronto uses the provincial booking system, you can actually go in and it says book your second dose, and you can, once you move it to an earlier dose, it cancels the second one. Okay. If you got it at a hospital clinic, you'll have to wait to hear from them. Right. And if you got it from a pharmacy, you'll have to follow up with them. That being said, if you don't have a second dose booked, you can actually also just book your second dose through the provincial booking system if you're eligible as well.
Okay, wonderful. And Doctor, can you just clarify for us the eligibility criteria currently for the second dose? I believe it's now 70 plus.
70 plus is what I understand. And also there's a date range. So if you got your vaccine sometime into April, and so I would suggest that, I don't want to misquote, but check on the website. If you go to the provincial booking system, it actually asks you the questions. And once you put in your information, it will actually tell you if you're eligible for an earlier second dose. I've done that for some of my family members. Some were eligible and some were not. And it did not allow me to book that second dose for those who were not.
Okay, so it's built into the system. That's great to hear. Perfect. And then let's move on once again to submitted questions here. Pullin asks, when we are concerned about the Delta variant, which affects the younger ones more, why don't we expedite the second dose for the younger people, especially since we have more doses now?
Okay, so when we talk about the Delta variant, yes, I mean, there's evidence that we have it in Ontario. How much it's spreading, it doesn't seem like it's spreading, though it may be replacing our B117 or the UK variant or Alpha, anyways, the new nomenclature. But our numbers are coming down, which is a good sign. So I think there's a couple things to note. One is, yes, there may be changes in the future for who can get an earlier second dose based on where you live to prevent the Delta variant. But in the meanwhile, there are many young adults who have not received one dose. Right. And I can say, you know, in Toronto, it's in the 60% that have been vaccinated with one dose in, for example, the 30 to 50-year-old age range. And so they need to come out and get their first dose in the meanwhile and to get those rates up higher.
Right, absolutely. Before we can even think of second shots, right? Okay, and then we've had this question before, but it's good to reiterate. Meher asks, can we get the second dose in a month if we want to travel and it is the visiting country's policy for people to be vaccinated?
So the answer is no. There is no ability to get your speeded up second dose because of travel. That is not an eligibility criteria in Ontario.
Right. Okay, and then Rose asks, and this is sort of a personal question to you, doctor. If you personally took the AstraZeneca for your first dose or have family members who did, what would you do or recommend for your family members for their second dose?
Okay, so I got vaccinated on January the 2nd because I work in an emergency department and I got the Pfizer vaccine. So, and that was the only vaccine that we had back then. I actually didn't know a lot about vaccines back then. But I certainly have had family members who in March got the AstraZeneca vaccine and still feel confident that that was a very good choice. My suggestion for the second dose is, first of all, the family member needs to decide for themselves. But I think the risk of that vaccine-induced immune thrombotic thrombocytopenia purpura, that severe blood clots, is something that's good to avoid if you can, in which case I feel that the recommendation to get the Pfizer or Moderna, a messenger RNA vaccine, is a very good choice for that reason.
Right, makes sense, because it's why take extra risk? There is lesser risk with mRNA, and that makes sense, right? Absolutely.
And it may, in the long run, we may find that it provides the same or even better protection.
Yes, absolutely. Okay, we have a few minutes left, so I'm going to continue with these submitted questions. Shanze asks, if a person's antibodies remain after COVID-19, should they still get the vaccine?
Yeah, you know, we don't do routine antibody testing. And there's actually, even if your antibodies test positive or test negative, it's really hard to interpret them because it doesn't necessarily mean that you do or you don't have immunity. We do know, though, that those who have had COVID can get COVID again. And so I would definitely recommend that you get tested. Suppose you had an antibody test done today that showed you had antibodies. Will they still be present 6 months from now? Is it worth getting another test? I mean, that test where you get your blood taken, personally, that needle jab is a lot easier to do than that blood test.
Yeah, absolutely. From a needle for a person, absolutely. Okay, and then Linda asked, how is the study going on the Moderna vaccine when it comes to the inflammation of the heart? We heard something about younger males having inflammation of the heart after Moderna.
Yeah, so this is something under really active discussion and observation and analysis. And so I think we can look to the US is probably going to put out some more information. Canada is reviewing this very closely. There was an article just published in Pediatrics that looked at 7 young teens or adults that got the vaccine and got pericarditis or myocarditis, and what their symptoms were. They resolved with treatment. And so, there's more to come on this. So I think it's something to really closely monitor. Moderna versus Pfizer versus AstraZeneca. And so that is being looked at in Canada. And I hope that in the coming days, I can provide updates on that for sure.
Absolutely. So the study is still ongoing. I mean, we haven't really seen the results of the study because it's ongoing, right?
And it's not necessarily a study versus real life data on people who have been vaccinated. I think what is clear is that it's more common in men, more common in the younger age groups, and more common following that second dose as well. So I think that's another important point to note.
Okay, and I have 1 minute left. I'm going to squeeze in this last question. Karen asks, can you get a vaccine if you have an autoimmune flare-up currently?
Yes, you can. And it may actually be really important for you to be vaccinated because you may be more at risk if you got COVID and getting severe COVID. Now, depending upon the medications that you're on, if you have an autoimmune flare-up, you would want to talk to your doctor because you would want to, as much as you can, try and time the vaccination so that your body can develop the best immune response. But it's definitely safe and recommended.
Right, absolutely. And that brings us to 1 o'clock. Thank you so much, Doctor, for taking the time and your patience with answering these questions. Thank you to everybody that submitted live once again and to our submissions over the week as well. We'll have the doctor back here again next week, so you can continue to ask your questions then. For now, we'll sign off. Thank you so much, Doctor.
Bye.
Bye-bye.